Hello everyone. So let me just check I'm audible so that we can start the session now. Okay. So yes, all the best to everyone. So yes, this is the session for Let's Crack NEET PG channel. That is the Abdomen and Pelvis MCQ series. This is the part 3 of the session. Okay. So yes, everything is fine and we can start the session now. Okay, so let's target the session now. Before that, I would like to tell you about myself. Myself, Dr. Monalisa. I have done my MD Anatomy from Armed Force Medical College, Pune, and I am here to discuss the anatomy MCQs related to the topic of abdomen and pelvis. And I have got total of 8 to 9 years of teaching experience. And let's start with the session now. Before that, I would also like to tell you about special class features. What are the features of special class? It's an interactive session where the learners and the educators interact. Polls are conducted and all the aspirants can participate in poll and they can ask their doubt live. That is another important point. Yeah, good evening, dear. Never ever miss a session. So what happened, if you start seeing the session on the Unacademy app, you can follow the educator and thereafter you will get notification regarding the session. Lecture notes. So once the session is finished, PDF notes can be downloaded by you. That is highly beneficial. Anytime, anywhere, read from the top educators of Unacademy platform. I would also like to tell you about cadaveric images session. So my dear aspirants, I would like to tell about cadaveric image session, that is session 2nd and 3rd. So this cadaveric image MCQs, 2 MCQs. So the first MCQ session was taken on the YouTube channel today itself, and this will be followed by the 2nd and the 3rd session, which is going to happen on 16th of January. So Sunday, that is 16th January. So this is happening on 16th Jan, Sunday, and this will be highly beneficial for you. Okay, so the students who want to be present for the session live, they can use my code ANAT10 as an unlock code and they can present live for the session. I would also like to tell about the upcoming session. Like 2 sessions are today taken by me. So 3 p.m. session, I have took a session on cadaveric image MCQs. So all those who have missed out that session, so sure see that session. Okay, abdomen and pelvis, we will conduct the session just now. I would also like to tell that tomorrow is 15th January. On and 15th January, 8 p.m. is the timing where I'm going to take a session of skeleton muscle. Actually, this is an integrated session taken by me and Dr. Dipti. Skeleton muscle topic, and along with the MCQ, along with the anatomy and physiology, we will discuss the topic. It will be highly beneficial for you. I would also like to tell about all plus subscription. All 19 subjects are completed in a very systematic way. You can assess both live and recorded version. You can be the part of live session. You can target your dream rank in the competitive exam. You can study from top educators of Unacademy platform, and also you can compete live in the test sessions. Study on the device of your choice. Alfred, hello, and assess 25,000 MCQs, which is clinical MCQs. All these clinical MCQs of all 19 subject, which is based on recent pattern of examination, effective explanation for each and every MCQ. This can be targeted by you. Coming soon, if you are going to take the subscription of Unacademy of 1 year or more, you will also be provided with the printed notes of the plus subscription of Unacademy. So go for it. I would also like to tell about iconic subscription. When I am talking about iconic subscription, that means that means Unacademy and the Prep Ladder is merged together. So that means you can access the best of the 2 platform, clinical integrated sessions, video lectures from the dream team. QBank 3 can be accessed, rapid revision, snapshots, and treasure dream notes of 2021. So all these benefits can be acquired by you. Yes, anatomy and physiology combined. Tomorrow session 8 p.m. live on Future Doctor, Unacademy Future Doctor channel. Yeah. Yes, Mulai. Now these are the benefits of iconic subscription. Grab the opportunity, take the subscription, use the code ANAT10 for getting additional discount of 10%. Now I would also like to show you the pricing detail of Plus and Iconic, where you can compare the pricing detail of both the subscription, and you can use my code ANAT10 for additional 10% discount. Students of 1st and 2nd year can go for 4 years of subscription because they can clear their prof exam along with their next preparation. So my dear aspirants, I would also tell about the test which is going to happen. So today two test information I want to tell you. One is the 21st January test, that is the on 21st January. 9 p.m. the test is going to happen, and in this exciting Amazon vouchers and the prizes, so that will be highly beneficial for you, my dear aspirants. So go for it. This is highly beneficial. Use the unlock code or enroll. Get enrolled by using the code ANAT10 for anatomy test, which is going to happen on 21st January. I would also like to tell and give you the information regarding the test of pathology, which is going to happen today after 2 hours, that is 14th January 9 p.m. This is the test of pathology MCQs which will be taken, which is actually made by the Dr. Priyanka Sachdev. You can get enrolled for this test by using the code ANAT10. Okay, so congratulations the toppers who have got a very good marks in the competitive exam of FMG December session 2021. I want to congratulate them, and I am very happy to share their images with you, and I give them best of luck to crack the NEET PG exam in the first go. Okay, I would also like to inform you about the highly effective QBank series, that more than 25,000 high-yield clinical MCQs, which is based on latest pattern of examination and is also including a detailed explanation for each and every MCQs. So my dear aspirants, go for it, take the subscription, use my code ANAT10 and get 10% discount. Now, the other thing before starting the session is that the students and aspirants want to know which are the sessions which is right now live on the Unacademy Plus subscription. Target NEET PG 22 batch MCQ discussion batch taken by the top educators of Unacademy platform. A Focus FMG 22 comprehensive batch taken by the top educators of Unacademy platform. So go for it. So yes, let's start session. Let's focus on this. So let's start with the first MCQ. Let me read it for you, and all of you can give the answers in the messages, and whether it is right and wrong, that doesn't matter. I will come up with the explanation. A 75-year-old man with 40 packets of with a history of 40 years and 40 packet per day, history of smoking and hypercholesteremia, is diagnosed with severe atherosclerosis. Atherosclerotic occlusion of which of the following artery could result in insufficient perfusion of the urinary bladder? So the options are external iliac, inferior epigastric, internal iliac, internal pudendal artery. So my dear aspirants, 4 options are there and you have to give the correct answer. Question number 1, your time starts now. 30 seconds will be given to you. So, okay, I got an answer from Vedan A. What about others? What about others? History of 40 packets of cigarettes per day and history of 40 years of smoking. So, the arteries which is causing insufficient perfusion of urinary bladder. Which of the following artery is involved? External iliac, inferior epigastric, internal iliac or internal pudendal artery. Your time starts now. Mark the correct answer, my dear aspirants. Question number first. So the correct answer is question number 1. The correct answer is, so actually the key point which is mentioned here, if I talk about the key points, insufficient perfusion of urinary bladder, that means the artery which is giving blood supply to urinary bladder is the correct answer. So we have to know which arteries are giving blood supply to urinary bladder. We know that there is superior vesical artery and there is inferior vesical artery. So the word vesical means pertaining to urinary bladder. The word vesical means pertaining to urinary bladder. So these are the arteries which is involved, and these are the arteries which is involved in giving blood supply to urinary bladder. So actually these arteries are the branches of internal iliac artery. So both superior and inferior vesical arteries are the branches of anterior division of internal iliac artery. Internal iliac artery. So if we have to go with the correct answer, we will go with internal iliac as the correct answer. That is option number C is the correct answer. Okay. So let's come up with the explanation. The same thing has been written here for a proper explanation. The bladder, the urinary bladder supplied by vesicular branches of internal iliac artery, and we know that internal iliac artery arises from common iliac artery. That means internal iliac artery has to be the correct answer. So here, my dear aspirants, so here I want to show you a diagram where you can appreciate the branches of internal iliac artery. Internal iliac artery is one of the branch of common iliac artery. The bifurcation occurs and it is dividing into internal and external iliac artery. External iliac artery will traverse lower down and below the level of inguinal ligament will change its name to femoral artery. Internal iliac artery is an important artery of the pelvic region. Its anterior division is giving branches, that is the obliterated umbilical artery, superior vesical, obturator, inferior vesicle and vaginal uterine, middle rectal arteries, the internal pudendal artery and that of inferior gluteal artery. Other than that, we have got 3 branches from the posterior division: lateral sacral, superior gluteal and iliolumbar artery. So these 3 branches, that is iliolumbar, lateral sacral and that of superior gluteal artery, these 3 branches are the branches from the posterior division. If we talk about anterior division branches, we have got many branches, and all these which I have pointed with the red color are the branches of anterior division of internal iliac artery. So here clearly we have seen that superior vesicle and inferior vesicle, both pertaining to urinary bladder, are the branches of internal iliac artery. Let's move on to the next, that is question number 2. While exposing the kidney from behind, so when we are while exposing the kidney from behind, all of the structures are liable to get injured except, okay, so mark your correct answer. While exposing the kidney from behind, all of the following structure are getting injured, liable, except which of the following structure is not getting injured? Lateral cutaneous nerve of thigh, ilioinguinal, iliohypogastric or subcostal. So your time starts now. Mark the correct answer. Amit Behra has given 2 answer A. What about others? Welcome Amit. Mark the correct answer. Mark the correct answer, dear. Your time starts now. Mark the correct answer. Okay, what about others? So that means in this MCQ we have to know the posterior relation of kidney. So we have to know all important muscles, nerves and other structures which is lying on the posterior relation of kidney and which is not lying exactly. So Mulai has also given the answer. Actually the correct answer is lateral cutaneous nerve of thigh, which is exactly not lying in the posterior relation of kidney. So lateral cutaneous nerve of thigh is not going to get injured when the kidney is approached from behind. Other than that, ilioinguinal, subcostal, iliohypogastric, all these nerves are lying in posterior relation of both the kidney, right and the left. Now see here. So I have enumerated, so all of you please note down all the structures related to the posterior aspect of the kidney. So when we talk about posterior relation of kidney, the relations are, it is related to diaphragm and the medial and lateral arcuate ligament, okay, medial arcuate ligament. When we talk about the relations of the muscle, it is related to psoas major, quadratus lumborum, transverse abdominis and subcostal vessels. So all these structures, okay. So we have got 3 muscles for quadratus lumborum, the transverse abdominis and the psoas major muscle, along with the subcostal vessels which is related on the posterior aspect. When we are talking about the nerves are subcostal nerve, iliohypogastric, ilioinguinal and also 12th rib and 11th and 12th rib. So we have got liver on the right hand side. So in the right hand side only 12th rib, but in the left hand side we have got 11th and 12th rib related in the posterior aspect. I would also like to show you a diagram for this. So I would also like to show you a diagram for all these relations. So let's move on to the diagram now. So my dear aspirants, the diagram which I am showing you is showing the posterior relation of both the kidney. So let's focus on the posterior relation of both the kidney. So write down posterior relations of kidneys. So that is both right and the left kidney. So here what you can appreciate when we are talking about the ribs, if I talk about the rib relation, so if I talk about the relations of the rib, so in the case of ribs relation, what you can see, 12th and 11th rib, 12th and 11th rib, this both ribs are related in case of left hand side, but only 12th rib in case of only 12th rib in case of right hand side. Why? Because in right hand side we have got a heavy organ liver lying superiorly. Now if I talk about the nerves are subcostal nerves and vessels. So nerves is subcostal nerve, iliohypogastric nerve, ilioinguinal nerve. If I talk about the muscles related on the posterior relation as we move from medial to lateral, so medial most muscle will be, so the relation or medial most muscle is, so see here, the medial most muscle is psoas major. So this is the area which is having relation here with this, the psoas major muscle on both the side. Intermediate area of the posterior surface of kidney. So this is psoas major muscle which is lying in the medial most relation. Intermediate area on the posterior side will be related with which will be related with quadratus lumborum and laterally with the transverse abdominis muscle. So this is the whole area of quadratus lumborum, and laterally the muscle related will be transverse abdominis muscle. So this is the lateral one. So it is important that you should know exactly the relation of structures, exactly the area which is involved. So psoas major muscle is in the medial posterior aspect, intermediate area quadratus lumborum, and lateral area is by transverse abdominis. Got it? So all these relations of the posterior aspect of both right and the left kidney has been shown. Let's move on to the next, that is question number 3. Okay, so a 50-year-old male is brought to the emergency department by ambulance after having been involved in a traumatic accident. He complains of abdominal and pelvic pain. The abdomen was also found to be tender on palpation in all the 4 quadrants. Genitourinary examination. When we go for genitourinary examination, so genitourinary examination reveals severe ecchymosis in the perineum and fresh blood seen in the urethral meatus. Radiographic reveals multiple fracture of the pelvis. Retrograde urethrogram is performed and leakage indicates urethral tear at the point of membranous urethra. Okay, so into which of the following space is the dye most likely leaking? So my dear aspirants, यहाँ पे जो key points है which will help you to come across to the correct answer is injury is here to which part of urethra? Membranous urethra. And fracture, multiple fracture of pelvis is there. So in this case where multiple fracture of pelvis and also the location of injury is mentioned, so we have to know the space where the dye is most likely leaking and which is the area where the fluid will accumulate. The options are superficial perineal space, extraperitoneal space, rectovesical space, and none of the above. So Amit Behra has given superficial perineal space as the correct answer. So Amit, so I will once more tell you that the area injured is membranous urethra, multiple fracture, and it is membranous urethra. So that is the key point to help you to come across the correct answer. Okay. So let's see whether it is A, B, C, D, which is the correct answer. The correct answer, my dear aspirants, is extraperitoneal space. Okay, B will be the correct answer. Okay, superficial perineal space is not the correct answer. It is wrong. Why? Because this space will accumulate with the fluid when there is injury of bulbar spongy urethra, bulbar or spongy urethra, then only it will be involved. So that is the reason. If there is injury of spongy urethra, bulbar urethra, then only the accumulation of fluid will be in superficial perineal space. Extraperitoneal space will be the correct answer here where the accumulation of fluid is occurring. And if rectovesical space is inside the peritoneal cavity, that will only occur when the injury in the peritoneal cavity is there. So we will go with B as the correct answer. Let's come with the explanation. The tear in the membranous urethra is the type of, yes, Amit, is a type of deep extravasation, and deep extravasation of urine will spread upwards and will go to proceed in the extraperitoneal space of the bladder around the urinary bladder and prostrate into anterior abdominal wall. My dear aspirants, अगर membranous urethra की बात करेंगे तो we know that membranous part of urethra is lying is surrounded by which muscle? Urogenital diaphragm, and this urogenital diaphragm is made of deep transverse perineal muscle and sphincter urethrae muscle. So these are the structures which will rupture, and then the membranous part of urethra will be rupturing. So here if we talk about superficial perineal pouch and anterior abdominal wall, so this diagram is showing the injury for the bulbar urethra or the spongy urethra. But if there is injury of membranous urethra, extravasation of urine will be occurring in the extraperitoneal space of the pelvis, which is the accumulation of fluid around the bladder and the prostrate. So location is very, very important. Okay, now my dear, so we have got the correct answer. Now let's proceed on to the other option which is provided. One of the option is option A, which is wrong, and the reason is that the superficial perineal pouch space is not accumulated. It could not have the urine accumulated in this case because the tear is not in the spongy part, but the tear is in the membranous part. When the tear is in the spongy part of urethra, then the accumulation will be in the superficial perineal pouch. Actually, this is also very importantly asked so many times in the MCQ session of previous year NEET PG examination. The other option C, rectovesical space, is again not the correct answer. The reason is that it's the portion of the peritoneal cavity that is exactly lying between the rectum and the bladder and is the lowest part of the peritoneal cavity. So it will not go inside the peritoneal cavity when there is injury into the membranous part. Rupture of urethra is an extraperitoneal structure and it could not result in leakage of urine inside the peritoneal cavity. So it will not go inside the peritoneal cavity, the urine accumulation. See the diagram. See here, when there is rupture of bulbar urethra or the spongy urethra, you can see the urine accumulation occurs in the superficial perineal pouch, and there it can also ascend upward direction. So in this diagram you can clearly see it can also ascend in upward direction towards the superficial, in the just over lower part of anterior abdominal wall, but it will not go in extra peritoneal space. Extra peritoneal space mein accumulation hoga if there is injury of membranous part of urethra, if there is injury of urogenital diaphragm. Okay, let's move on to the next MCQ, that is MCQ number 4. Fundus of gallbladder lies in an angle between lateral border of the rectus abdominis muscle and the level of tip of 9th costal cartilage. The vertebral level is the lower border of T11, T12, L1 or L2. According to you, which is the correct answer, my dear aspirants? Please mark the correct answer. Your time starts now. Question number 4. Mark the correct answer. Fundus of gallbladder. Fundus of gallbladder in an angle between lateral border of rectus abdominis and tip of 9th costal cartilage. So these are the key points which is mentioned here, and you have to mark the correct answer. Amit is telling it's C. What about others? The correct answer is L1. So yes, so Amit, you are, so yes, Amitabh, you're, okay, it's Amitabh. You're absolutely right. L1 is the correct answer. Actually, fundus of gallbladder. So, and 9th. So, two key points are given. One is the location of fundus of gallbladder is the key point, keyword, and the other is tip of 9th costal cartilage. So, this is telling us that this level is which plane? So, this is exactly telling us the location is at which plane? Transpyloric plane. The location is at transpyloric plane, and we know that transpyloric plane is exactly located between midpoint of the suprasternal notch and pubic symphysis. So, transpyloric plane is exactly located in the, you can say, midway between, it is located midway between suprasternal notch and that of pubic symphysis. So we have to choose one. We will go with L1 as the correct answer. Okay, so my dear aspirants, let's proceed. So I would like to tell that it is important that the fundus of gallbladder is exactly located in the angle, and we know that the correct location was between the costal margin and lateral margin of rectus abdominis muscle. The fundus is the same level at the transpyloric plane, and we know that lumbar vertebra to which it is corresponding is L1 lumbar vertebra. Now let's proceed. Structure approximately located at this level. So if we talk about transpyloric plane, its level is corresponding to the L1 lumbar vertebra. So in the MCQs, and we have seen that it has been asked many times, the structures located at the level of L1 and lumbar vertebra or at the plane of transpyloric plane. So at the level of transpyloric plane, Addison plane, the structures lying are, list of structure is the ending of the spinal cord, that is conus medullaris. What is it? It is conus medullaris. Annual lumbar vertebra, origin of superior mesenteric origin of portal vein formation behind the neck of pancreas by joining superior mesenteric vein and that of splenic vein, neck of pancreas, pylorus part of the stomach. So only it is called as transpyloric plane. Second part of duodenum, sphincter OD. Hilum of the each kidney, DJ flexor, duodenum and jejunum junction, fundus of gallbladder and tip of ninth costal cartilage. So please do revise all these structures located exactly at the level of transpyloric plane. Let's move on to the next, that is question number 5th. Question number 5th. Let's move on to the next, that is question number 5th. Okay, so I will read the MCQ for you. A patient with a history of chronic gastroesophageal reflux disease. A patient with a history of chronic gastroesophageal reflux disease, GERD, is admitted with to the emergency OPD. He has severe heartburn and chest pain. Biopsy of the esophagus reveals a change in the epithelial lining of lower 1/3 of esophagus from squamous type of epithelium. So what is the change of epithelium which is seen in this case? The change of epithelium is from squamous epithelium to that of columnar epithelium. So this is the key point, my dear aspirants. You have to pay attention to this point, keyword, so that you can mark the correct answer. The patient was prescribed proton pump inhibitor drugs and endoscopy was also suggested in this case. He was then discharged. What would be the common clinical condition associated with the esophagus of this person? Whether it is a case of esophageal structure involved, whether it is a case of Barrett esophagus, whether it is a case of Ginker's diverticulum, or none of the above. So already Amitabh Behra has given the answer, and yes, Amitabh Behra has already given the answer. Mulay has also given the answer, and my dear aspirants, yes, metaplasia, change of epithelium, columnar metaplasia, and this is the case of Barrett esophagus. Both of you are absolutely correct. Absolutely correct. Okay. So let's proceed with the explanation. Now, the key point which is mentioned here is the epithelium change, which is a case of metaplasia which is happening, and here the epithelium will change either to columnar epithelium or that cuboidal epithelium due to chronic exposure of acidic reflux taking place from the stomach. The cause will involve in distortion of the mucosal lining and dissolving it and causing severe heartburn and chest pain. Sometimes hematemesis can also occur in case of severe cases, and this is the common condition which requires treatment for reduction of acid secretion, that is done by giving proton pump blockers, and this will cause decrease in acid production. So exactly the cases of Barrett esophagus. So we have got the correct answer, that is Barrett esophagus. Yes, yes, you are absolutely right, Akani. Okay. Now, option A was esophageal stricture. Actually, a structure involved, yeah, esophageal stricture means stricture, a esophageal stricture. So, better is esophageal stricture. Abnormal narrowing is seen in the esophageal lumen, and if that would be the condition, the presentation of the patient much involve difficulty in swallowing. So, this symptom was not presented in the case, so this is not the correct answer. Other than that, there is no dysphagia as in the case of esophageal stricture cannot be the case. Now let's move on to the Ginker's diverticulum. Another option was Ginker's diverticulum. So when the patient is suffering from Ginker's diverticulum, which is also called as pharyngeal pouch, okay, which is also called as pharyngeal pouch. In this case, the diverticulum is of the mucosa part of the human pharynx, and the location is exactly above cricopharyngeal muscle. Cricopharyngeal muscle, that is above upper sphincter of esophagus. The pseudo diverticulum which is forming is not involving all the layers of esophagus, and actually when we are telling the case of Ginker's diverticulum, there will be again other presentation clinical symptoms which is attached is dysphagia, difficulty in swallowing, regurgitation, halitosis, bad breath from the mouth. So none of such cases or clinical symptom was presented in the case, so we will not go with Ginker's diverticulum as the correct answer. So see here, the cricopharyngeus muscle, and just actually it's the pouching, it's inferior constrictor muscle has a gap, two parts, crico and thyropharyngeus. So in that you can see the pouch which is protruding out is the Ginker's diverticulum. Let's move on to the next MCQ, that is MCQ number 6. All the best. Luminal narrowing of which of the following vessel could compromise the blood flow through renal arteries? So if there is narrowing of which of the following vessel, it will also affect the blood flow through renal arteries. Whether the correct answer is abdominal aorta, celiac trunk, common iliac artery, or inferior mesenteric artery. So your time starts now. Mark the correct answer. Siddhesh is telling D is the correct answer. So Siddhesh is coming up with D as the correct answer. Let me just see whether it is correct or not. What about others? Okay, so inferior mesenteric artery. What about others, dear? 6. Okay, I got an answer from Amitav as A. The correct answer is A. So actually we know that renal arteries are direct branch of abdominal aorta. So if their source is getting narrowed, so the flow of blood from renal artery will be compromised. So we have got abdominal aorta as the correct answer. So here the renal arteries, as we know, it's emerging out from the source, that is abdominal aorta, and the level is at the level of L1 and L2. So where is the renal artery emerging? Exactly at the level of L1 or L2 intervertebral disc, and they are traversing at right angle and then going towards the hilum of the kidney. So on right side they are passing posterior to inferior vena cava. So if the source of renal artery, and we know that renal artery is a branch of abdominal aorta, so we will pick abdominal aorta as the right answer. Okay, so see here. So here I want to show you the diagram where you can see the abdominal aorta is shown to you. This is the abdominal aorta, and you can see important branches of the abdominal aorta. So so you can see here celiac trunk, which is given at the level of T12. We have got superior mesenteric artery, which is given at the level of L1, and we have got inferior mesenteric artery, which is given at the level of L3. So these are direct ventral branches. You can also see the renal arteries. Okay, so renal arteries, we have got right and the left renal arteries. So these are the branches of abdominal aorta, and the other branches directly is the phrenic artery. Inferior, it will be inferior phrenic artery, lumbar artery hoga, common iliac arteries hoga, right and left. So all these are the branches, as you can see, and this is providing major blood supply to the kidney. So its source is abdominal aorta. So abdominal aorta is the correct answer. The other options which is provided is not correct. Celiac trunk is not the correct answer. We know that celiac trunk is also the branch of abdominal aorta, but it is giving branches as common hepatic, splenic, and the left gastric as the direct branches. So none of these arteries were involved in the case, so this is wrong. Common iliac artery is again giving out internal and external iliac artery, in addition to unascended pelvic kidney may be supplied. So common iliac artery is again not providing blood supply to the kidney directly. In cases of if the kidney is not ascended to its correct position, in that case the blood supply source will be common iliac artery, but this is not an abnormal condition. This is a normal condition which was not mentioned. If abnormally condition hota or unascended kidney hota, then we could have gone with common iliac artery is the correct answer. Let's move with the other one. Again, superior inferior mesenteric arteries are not correct, because we have yesterday also I have shown you an image where I have shown you important branches of inferior mesenteric artery. Inferior mesenteric artery is giving blood supply in the form of superior rectal, sigmoidal, and left colic artery. So these are the three branches: superior rectal, sigmoidal, and left colic. It is not giving any blood supply to kidney, so it is not a correct answer. The superior mesenteric artery again is not the correct answer. It is giving inferior pancreatico-duodenal artery, ileocolic artery, jejunal ileal arteries, and right colic. So this is also not providing any kind of blood supply to the kidney. So in superior mesenteric artery is also the incorrect option. Let's move on to the next, that is question number 7. To avoid damage to the structures entering in the porta hepatis and blood vessels supplying stomach of Omental bursa can be approached by incising which of the following structure? falciform ligament, hepatoduodenal portion of lesser omentum, transverse mesocolon or superior layer of coronary ligament. To avoid damage of the structures which is entering the porta hepatic region and blood vessels supplying stomach. So, which of the following structures should be incised to reach falciform? So, please mark the correct answer. So, how we are going to reach the omental bursa, and we are not going to disturb any of the structures of the porta hepatic region supplying and the blood source of the stomach. So, that means we have to go lower down. So, that is the hint which is provided. So, which of the following is the correct answer, dear? So, yes, all of you are telling no. So, D, no. We will go with transverse mesocolon as the correct answer. My dear aspirants, whenever the transverse mesocolon is approached, it is not going to damage any of the structures of the porta hepatic region. So, Y2 porta hepatic region is related to the liver. This is the region which is lying in the free margin of the lesser omental hepatoduodenal ligament, blood vessels of the stomach. So, actually we will not want to dissect any of the structure which is lying in close association with the liver. So, superior coronary ligament is also associated with liver. Hepatoduodenal portion is carrying the vessels of the porta hepatic region, and falciform ligament. So, why to approach any of the structures close to the river? So, we will approach it through transverse mesocolon, that is the safest part. So, see here, I also want to just describe transverse mesocolon in brief. So, transverse mesocolon is a broad fold of peritoneum which suspends the transverse colon from the upper part of the posterior abdominal wall. Okay. So, this is the fold. So, transverse mesocolon is the peritoneum fold which is suspending the upper part of posterior abdominal and is falling a peritoneum covering for the transverse colon. If we talk about its attachment, root of transverse mesocolon is attached to anterior aspect of the body of pancreas and the head, and it is in the horizontal aspect with slight upward inclination towards the left. So, the attached part is attached in horizontal line with slight inclination to the left over pancreas, anterior body and head. Now, see this diagram where you can see this is the area of transverse mesocolon. See here. So, this is exactly the area which you are seeing, the transverse mesocolon. Few vessels are lying, but it is not exactly giving any kind of blood vessels entering for the porta hepatic region. So, the content it contains middle colic artery, nerves, lymph nodes and lymphatics to transverse colon. So, basically when we will cut through the transverse mesocolon, we are not going to injure any of the vessels which is giving blood supply to the stomach or any of the vessels which is lying in the porta hepatic region, that is the hepatic arteries. So, that is not going to be disturbed. So, we will go with excision of the transverse mesocolon as the best answer or the best approach. Okay, let's move on to the next, that is question number 8. Root of mesentery crosses all structure except. Root of mesentery is crossing all the structure except ascending and horizontal part of duodenum, abdominal aorta, inferior vena cava, right ureter and splenic artery. Root of mesentery crosses all structure except. So, 5 options are there. Mark the correct answer. Root of mesentery crosses all structures except ascending horizontal part of duodenum, abdominal aorta, inferior vena cava, right ureter or splenic artery. Your time starts now. Mark the correct answer. So, Amit Behra has given the right answer. What about others? Root of mesentery crosses all except. So, go for the best option, Amit. So, yes, we will go for the best answer. So, if we have to choose one of the best answer, we will go with the Best answer, splenic artery is the correct answer. Splenic artery is not getting crossed by the mesentery. So yes, horizontal part we already know that it is crossing, we know abdominal aorta, inferior vena cava and right. All these structures are crossed. Actually initial and slight part of ascending aorta, ascending part of the duodenum is also crossed, but basically splenic artery is not crossed by the attached margins of the mesentery, which is extending from duodeno-jejunoflexor and going approaching towards the right iliac region near sacroiliac articulation. So splenic artery is the correct answer. My dear aspirant, root of mesentery successfully crosses following structures. So root of mesentery successfully crossing ascending and horizontal part of duodenum, abdominal aorta, great vessels, that is inferior vena cava, right ureter, right psoas major, right testicular and ovarian vessels. So all these structures which is mentioned here can be crossed by root of mesentery but not the splenic artery. So we will go with splenic artery as the correct answer. So see here, structures crossed by root of mesentery. So here you can see the attachment. So here let me use green color for the mesentery attached border. So this is the attached border of which is extending from duodenum and jejunum junction and going till the level of ileocolic junction. That means it is crossing from left hand side to the right hand side. Okay, the structures being crossed is horizontal part of duodenum, abdominal aorta, inferior vena cava. I can understand because many times ascending part of duodenum is not included, so some of you can get confused, but splenic artery is sure shot not the correct answer. It is not lying at this level. Right gonadal vessel, right ureter and right psoas major. So all of you please do revise the structure being crossed by the attached border of mesentery. Got it everyone? Attached border of mesentery. Let's move on to the next one. Which of the following structure is avascular? Which of the following structure is avascular? Option A is superior ileocecal fold, inferior ileocecal fold, mesoappendix, appendix or cecum. Which of the following structure is avascular? Question number 9. Which of the following structure is avascular? Your time starts now. Mark the correct answer, my dear aspirants. Amitabh Behra, okay, it's okay. So I got an answer. What about others? So actually avascular fold of appendix close to appendix is inferior ileocecal fold. So inferior ileocecal is also called as bloodless fold of Trevis. Bloodless fold of Trevis is the word used for this because it is not having any blood supply or arterial supply. So we will go with B as the correct answer. Now see here, appendicular artery, we know that appendicular artery is a branch of ileocolic artery and ileocolic artery is again the branch of superior mesenteric artery. यहाँ पे हमें पता है appendicular artery is a branch of ileocolic artery and ileocolic artery is a branch of superior mesenteric artery. Okay, so appendicular artery is located in the mesoappendix and anterior cecal artery in the superior. So please note down. So we have got the location of appendicular artery in the mesoappendix, that is the peritoneum covering the appendix, and also in the superior ileocecal fold. So that means both appendix and cecums are vascular. Inferior ileocecal fold will be the correct answer, which is exactly the avascular structure, which is also called as bloodless fold of Trevis. It is also called as bloodless fold of Trevis because it is not having any blood supply. Okay. Now see here, I would like to show you this diagram where you can see inferior ileocecal fold. So here you can see the outline of vermiform appendix. Okay, and here you can see the peritoneal fold, which is shown here is the inferior ileocecal fold. This peritoneal fold is inferior ileocecal fold. Okay, this is inferior ileocecal fold, and this fold is not containing any blood supply. This is not containing any blood vessel. So it is called as ileocecal fold or bloodless fold. Here you can see anterior cecal artery, superior, it is a superior ileocecal fold, again having the arteries here, anterior cecal artery is lying there, superior ileocecal region mein. Appendicular artery is a branch for the appendix, so that is also not the correct answer. Let's move on to the next, that is question number 10th. Reflected inguinal, so reflected inguinal ligament receive fibers from the contralateral aponeurosis of which of the following muscle? External oblique muscle, internal oblique muscle, transverse abdominis, rectus abdominis or pyramidalis. So according to you, which is the correct answer? We have got 5 options and you have to pick the right answer. Reflected inguinal ligament receive fibers from contralateral aponeurosis of which of the following? So yes, your time starts now. Mark the correct answer. So I got an answer from Amitabh Behra. What about others? The correct answer is external oblique muscle. Aponeurosis of external oblique muscle will on both the sides, it's an extension. Actually, inguinal ligament, we know that inguinal ligament is formed by the aponeurosis of, so inguinal ligament, which is also called as Paupart's ligament. The other name of inguinal ligament is groin ligament. It is also called as Paupart's ligament. And okay, so groin ligament, Paupart's ligament, inguinal ligament, basically all these are the similar structure, and these structures is formed by aponeurosis of external oblique muscle. So actually there is a 4 extension from the inguinal ligament, which is in the form of reflected part, which is in the form of pectineal ligament, which is in the form of lacunar ligament, and we have got ilioinguinal ligament. So in this case, the reflected part will go medially in upward direction and will merge with opposite side reflected part of inguinal ligament. That means extension from the external abdominal muscle aponeurosis. Okay. So see here in this diagram, you can see this is the reflected part of inguinal ligament, which is one of the extension of inguinal ligament. The other is lacunar ligament. The third is the pectineal ligament. And one more is the ilioinguinal ligament. These are 4 extensions of the inguinal ligament. So here we can clearly see inguinal ligament, which is extending from anterior superior iliac spine and getting attached to pubic tubercle. Here from the inguinal ligament, the extensions are, so let me use green color. So here this extension, this triangular ligament on medial side, which is called as lacunar ligament, it's in a triangular ligament, attaches on the medial aspect. This is also called as Gimbernet ligament. The other name is Gimbernet's ligament. Other than that, you can see few fibers are reflected in upward direction and will merge with opposite side. This part is called reflected part of inguinal ligament. The third extension is pectineal ligament, which is an extension protruding from that of the Gimbernet ligament to the level of ilio, through the eminences. That this eminence or level is called as iliopectineal eminences. Okay, so the other name of pectineal ligament is pectineal ligament. So please note down, pectineal ligament is also called as Cooper's ligament. Actually, inguinal ligament extension is a favorite topic for MCQs for the NEET PG examination. So I am just giving you a brief detail. So also you can see inguinal ligament downward extension is there. This downward extension is called as ilioinguinal ligament, which is attaching on iliopectineal eminences. So these are 4 extensions of inguinal ligament. All we know that inguinal ligament is formed by aponeurosis of external aponeurosis, external abdominis aponeurosis muscle. So we have got here A as the correct answer. Okay, so done with this. So before ending the session, I would like to tell those who have missed out today's cadaveric image MCQ session can definitely watch it. I have taken today itself, so it must be streaming now. So you can just watch 3 p.m. today YouTube session of cadaveric image session and abdomen pelvis session now we have done. I would also like to tell that this cadaveric image session will be followed by special class. So I am not ending the cadaveric image session which I have started. It will be followed by 2 sessions which will be taken on Sunday. So Sunday is 16th January. 16th January is Sunday. So on Sunday we will have the session at 1 p.m. and 2 p.m. So I want each of you to be present live for the session. This will be highly beneficial for you. All of you can be present live for the session. The students who are watching the session for the first time on the Unacademy app, so download the Unacademy app and they should find their goal as NEET PG. They can mention Dr.Monalisa live session and can search, or the link of the session will be provided in Let's Crack NEET PG Unacademy Telegram group, so you can be present live for the session. I would also like to give you a detail of tomorrow's session which is going to happen on the Unacademy. So Unacademy Future Doctor. So there is a channel that is Unacademy Future Doctor. So yes, Amit Behra, so very nice. Your participation was very good and you have given many of the correct answers here. So Unacademy Future Doctor YouTube channel pay, I will take an integrated session about skeleton muscle. 15 January 8 p.m. is the timing, along with Dr. Dipti. So Dr. Dipti will tell you all physiology of the skeleton muscle. I will explain the morphological classification and details of the skeleton muscle. Now, my dear aspirant, I would also like to tell you about the anatomy test series which is going to happen on 21st Jan, and in just another 1 hour there is pathology test also, where you can enroll by using the code ANAT10. You can be present for this session. So all of you can use the code ANAT10 and get enrolled for this test. This test is going to happen on 21st Jan 9 p.m. Exciting prizes: rank 1 5,000 Amazon vouchers, rank 2 3,000, rank 3 2,000 Amazon vouchers are waiting for you. So just grab this opportunity. Okay. So yes, I would also like to share this highly effective QBank which is containing more than 25,000 MCQs of clinical questions based on recent pattern of examination, and also includes a detailed description given by the top educators of Unacademy platform. Students who want to take the subscription, they can use the code ANAT10 and get 10% discount. And I would like to lastly compare the Iconic and the Plus subscription pricing detail. Just go through it and have an additional 10% discount by using the code ANAT10. All the best. Keep studying. Thank you. So we will meet. I hope this session is useful for you. We will meet again with the exciting and new sessions, and we will crack our examination. That is the goal, with a better rank. So all the best. Do like, subscribe and share. Let's Crack NEET PG platform. Thank you. All the best. Keep studying. Thank you so much, my dear aspirants. Thank you.